Welcome to 5-Minute Health Tips. In this video, you will learn 8 signs and symptoms of diabetes. This video is for educational purposes only and does not replace a medical professional's advice. Diabetes is a chronic health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. With diabetes, your body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems, such as heart disease, vision loss, and kidney disease. Though there are more signs and symptoms of diabetes, we choose the following 8. Number 1. Excessive thirst and increased urination. Excessive thirst and increased urination are common diabetes signs and symptoms. When you have diabetes, excess glucose, a type of sugar, builds up in your blood. Your kidneys are forced to work overtime to filter and absorb the excess glucose. When your kidneys can't keep up, the excess glucose is excreted into your urine, dragging along fluids from your tissues, which makes you dehydrated. This will usually leave you feeling thirsty. As you drink more fluids to quench your thirst, you urinate even more. Number 2. Fatigue. Diabetes can make you feel tired. High blood glucose impairs your body's ability to use glucose for energy needs. Dehydration from increased urination also can leave you feeling fatigued. Number 3. Weight loss. When you lose glucose through frequent urination, you also lose calories. At the same time, diabetes may keep the glucose from your food from reaching your cells, leading to constant hunger. The combined effect can potentially cause rapid weight loss. Number 4. Blurred vision. Diabetes symptoms sometimes involve your vision. High levels of blood glucose pull fluid from your tissues, including the lenses of your eyes. This affects your ability to focus. Left untreated, diabetes can cause new blood vessels to form in your retina, the back part of your eye, damage established vessels. For most people, these early changes don't cause vision problems. However, if these changes progress undetected, they can lead to vision loss and blindness. Number 5. Slow healing sores or frequent infections. High levels of blood glucose can lead to poor blood flow and impair your body's natural healing process. Because of this, people with diabetes may notice slow healing sores, especially on the feet. In women with diabetes, bladder and vaginal yeast infections may occur more often. Number 6. Tingling hands and feet. Too much glucose in your blood can affect the function of your nerves. You may notice tingling and loss of sensation in your hands and feet, as well as burning pain in your arms, hands, legs and feet. Number 7. Higher blood level glucose. Hyperglycemia, or high blood glucose, occurs when there is too much sugar in the blood. This happens when your body has too little insulin, the hormone that transports glucose into the blood, or if your body can't use insulin properly. Hyperglycemia is blood glucose greater than 125 mg per deciliter while fasting, not eating for at least 8 hours. A person with a fasting blood glucose greater than 125 mg per deciliter has diabetes. Number 8. Excessive hunger or polyphagia. Polyphagia is the medical term used to describe excessive hunger or increased appetite and is one of the 3 main signs of diabetes. An increase in hunger is usually a response to normal things such as intensive exercise or other strenuous activity. Hyperglycemia, where blood glucose levels remain abnormally high, glucose from the blood cannot enter the cells due to either a lack of insulin or insulin resistance, so the body can't convert the food you eat into energy. This lack of energy causes an increase in hunger. Simply eating will not get rid of the hungry feeling of polyphagia in people with uncontrolled diabetes, as this will just add to the already high blood glucose levels. The best way to lower blood glucose levels is to exercise, as this can help to stimulate insulin production and reduce blood sugar levels. If you notice any possible diabetes signs or symptoms, contact your doctor. Diabetes is a serious condition, and the earlier it's diagnosed, the sooner treatment can begin. If you like this video, please like, subscribe and hit the bell for us, so you'll get notifications for our future uploads. All the best from the 5-Minute Health Tips team.